My name is Sheen Dube, and I'm a grade 11 student at St. John's Raymond-Square School. I will be presenting the research project I was a part of. This research project looked at whether or not neutrophil-to-lymphocyte, monocyte-to-lymphocyte, and platelet-to-lymphocyte ratios can predict prognosis in patients who have undergone stereotactic body radiation therapy, also known as SBRT, for diagnosis of early-stage non-small cell lung cancer. SBRT is a sophisticated modern technique of delivering a very high dose of radiation to different tumors. To give you some background, it is well known that the immune system and inflammation play a big role in the development, progression, and treatment outcomes of many cancers. Generally, anyone with a strong immune system will perform better than someone with a weak immune system. In this study, we specifically looked at neutrophil-to-lymphocyte, platelet-to-lymphocyte, and monocyte-to-lymphocyte ratios, as they are known to be markers for inflammation with prognostic value for survival in patients with various solid tumors. The purpose of this project was to assess the prognostic significance of these pretreatment ratios of blood cells, which are surrogates for immune system, on outcomes in patients with early-stage non-small cell lung cancer patients treated with SBRT. Our hypothesis was that the higher the ratios, the outcomes should also be poorer. In terms of methodology, we reviewed the patient charts of early-stage non-small cell lung cancer treated with SBRT at Cancer Care Manitoba over an 8-year period beginning from January 2010 to December 2017. As I stated before, SBRT is essentially a modern radiation technique which enables radiation oncologists to deliver a very high dose of radiation to tumors with minimal radiation exposure to the adjacent normal tissues. Fortunately, these machines, which can deliver radiation using this specialized technique, are available in Manitoba. This data was screened and analyzed. The pretreatment ratios of neutrophil-to-lymphocyte, platelet-to-lymphocyte, and monocyte-to-lymphocyte were calculated, and the correlation to overall survival was determined. Appropriate statistical methods were employed to perform univariate and multivariate analysis that used neutrophil-to-lymphocyte ratios, platelet-to-lymphocyte ratios, monocyte-to-lymphocyte ratios, patient performance status score, internal target volume, age, and gender as covariates. We took help from statisticians for performing the statistical analysis. For our results, we collected data on 61 eligible patients. The patients ranged from ages 72 to 82 years old. The median internal tumor target volume was 11.2 cubic centimeters. The median values for neutrophil-to-lymphocyte ratios, platelet-to-lymphocyte ratios, and monocyte-to-lymphocyte ratios averages were 3.42, 156.4, and 0.39. On univariate as well as the multivariate analysis, we found out that only a higher neutrophil-to-lymphocyte ratio correlated with a poor overall survival. To conclude, our study showed that high neutrophil-lymphocyte ratio is associated with a higher risk of death in early-stage non-small cell lung cancer. Essentially, this ratio can be a valuable tool in predicting outcomes in early-stage non-small cell lung cancer treated with SBRT. Monocyte-to-lymphocyte ratios and platelet-to-lymphocyte ratios showed little to no relevance when looking for correlations between these ratios and overall survival. The possible explanation is that chronic inflammation in tumors leads to the release of substances by neutrophils and promotes some signal pathways. The result is tumor growth and proliferation. Lymphocytes are involved in cytotoxic cell death and inhibit tumor cell growth and proliferation. This study will need to be validated, and hopefully in the future, early identification of patients with high risk of failure could help develop strategies to intensify treatments of institute multimodality therapy. Thank you for listening to my presentation. I'd like to thank Dr. Srinivas Rathod, my mentor, for guiding me through this process. It was an incredible experience being a part of this study.